Welcome everyone to Travelers Week. I'm Katie Dashiell, Content Marketing Manager at Supplemental Healthcare. As a healthcare professional, you spend most of your days caring for others and putting their needs before your own. Your compassion and dedication set you apart from other professionals, but your work can also cause a lot of stress and lead to burnout. When was the last time you checked in on yourself? With all the uncertainty and additional demands of the COVID-19 pandemic, it's more important than ever to care more for yourself. We've compiled some tips, tools, and resources for managing your mental health and wellness through difficult times like these. So let's talk about how to care more for yourself. Today, I'm joined by Corey Wagner from our marketing team, one of my colleagues. So first, we're going to talk about some of the symptoms of stress that you may be experiencing. So I'll pass it off to Corey. Can you share with us some of those symptoms from the CDC's resources for healthcare workers?
Definitely. So during this time, you might be feeling a lot of different things: irritation, anger, denial, uncertainty, nervousness, anxiety, helplessness, being powerless, having a lack of motivation, being tired, overwhelmed, or even burned out. You could be sad, depressed, having trouble sleeping, or even having trouble concentrating. All of these feelings can be detrimental to your well-being and your work. And as an essential worker, you have an important role in the fight against this pandemic, and you deserve to prioritize yourself as well. So as we talk through some of the ways to deal with stress, remind yourself that we're all in this together. You need to be able to openly communicate about job stress and identify solutions to deal with that stress and build resilience.
That's so important to remember. A lot of this is out of our control, so it's important to focus on what we can do for ourselves. What are some of the things you'd recommend to help decrease anxiety, build resilience, and decompress during these stressful times?
Now, that's a great question. So our first tip is to prioritize self-care. It's important to take some time for yourself, but even more so if you're taking care of others for a living. You can't give to others what you don't have yourself. Working 12-hour shifts is exhausting, physically, mentally, and emotionally. Physically running around and being on your feet all day takes a lot out of you. The mental strain of complex problem solving, decision making, and impulse control can quickly become overwhelming. And emotionally, being a great healthcare professional means that you care a lot, and that can become really taxing as well. Among their resources, the CDC has provided suggestions for healthcare professionals and first responders during COVID-19. Included in their points, they recommend creating a menu of personal self-care activities that you enjoy, such as spending time with friends and family, exercising, or reading a book. So with that being said, be sure to take time for yourself. Limit access to things that cause you stress and surround yourself with activities and things that bring you joy. If you're an avid reader, don't read the news. It can just add to your stress and bring anxiety on. Instead, find a good book and get lost in the story. Taking walks outside in nature can be rejuvenating in so many ways. Fresh air and sunshine can help regulate emotions and improve memory function. But if you prefer to stay inside, have an at-home spa day. Either way, take a staycation on your next day off and do whatever you need to relax and unwind. Taking time for yourself does a lot to reset your mental state, but don't forget about your body as a large part of your well-being too. You need the appropriate fuel to operate, be that rest, food, or just breathing more to get oxygen into your system. Sleep is imperative for various aspects of brain function, including memory, focus, and mood. And the right food can make a difference in how you feel. This all can seem pretty basic, but it's sometimes forgotten or neglected in times of heightened stress. Breathing seems pretty straightforward too. However, the way you breathe affects your whole body. Breathing exercises are a great way to help relieve muscle tension and reduce anxiety. There are several different techniques, such as belly breathing, box breathing, or roll breathing. So try a few out and find what works best for you. Meditating is also another great way to use your breath for calmness and grounding. Meditation can be very helpful before or after a long shift, offering you peace and centeredness to improve your mental state and overall health. If you aren't sure how to get started, find a meditation app on your smartphone. Personally, I like Insight Timer. You can also find guided meditations at the library, podcast, on YouTube, or even with your Audible subscription. And speaking of apps, the American Nurse Association launched a wellbeing initiative as a resource for nurses' mental health and resilience. The program includes easy access assistance to offer support whenever needed. For example, MoodFit is customized for nurses to support wellness goals. It enables users to set personal goals like mindfulness, meditation, and breathing exercises. It even facilitates customized reminders to schedule appropriate times for much needed breaks. They also have access to Happy App, warm lines specifically for nurses tackling anxiety, stress, fear, and isolation during the COVID-19 pandemic. This app connects you 24/7, one-on-one with the support team member from the comfort of your own home or wherever you are. And that leads us to our next point. It's important to recognize when talking to a professional might be a good option. Be sure to find out what resources are available at your workplace, as many organizations have prioritized the improvement of telehealth to protect their patients as well. This effort extends to therapy and counseling for healthcare workers. Talkspace is the world's leading online therapy company and provides free therapist-led Facebook support groups and a 16-day anxiety relief program to reduce and manage stress about COVID-19. They're also offering medical and healthcare workers a 50% discount off their first month of the Unlimited Messaging Plus plan. To sign up, you can register via the app or website, and you'll just need to provide verification with your NPI and state of residence. If you don't have time for a longer session or phone calls or video calls, you can also text Frontline to 741-741 for free crisis counseling via text through forthefrontlines.org. They can help you deal with anxiety, stress, fear, isolation, or other difficult emotions you're experiencing during coronavirus. What we really want to get across to all of our healthcare workers right now is that you're not alone in this fight. There's a large community going through the same issues. Communicate with your colleagues on assignment about what you're all going through, and reach out to other professionals in your field struggling with the same difficulties. You can also join an online community like a Facebook group designed to share stories and provide support in your discipline. The American Nurse Association also provides a virtual judgment-free zone via Zoom called Nurses Together, Connecting Through Conversations. This space connects nursing peers to share thoughts, seek support, ask questions, and can be a vital resource for you. These are peer-to-peer calls that are scheduled throughout the day and offered 7 days a week too.
Thanks for sharing all those, Corey. I think those are great reminders of how to check in with your mental health and wellness during this stressful time. I love that there are free resources out there specifically for our healthcare professionals and travelers. You all do so much to support us. We want to also lend our support for you. We so appreciate you looking out for your patients and clients every day. We hope this gave you a few ideas and resources to check out to improve your well-being. Subscribe to our blog for more ideas and resources for travelers. And for more free sessions like this, visit healthcaretravelersweek.com. Thank you all for joining us, and to Corey for helping me out today.
Thanks for having me. And don't forget to take care of yourself, stay hydrated, meditate, and everything's going to be okay.